Hey, Cam followers, it's been a busy week and we finished the week with the lovely Mel Bruder, lovely friend of mine who's going to be talking to us about splints and orthotics. So this is going to be a little bit more technical, but I really hope that the live tonight is going to give you guys a better understanding of how these implements, these instruments, these support structures can be beneficial, but how they might also be a massive hindrance. So Mel, please tell us all about yourself, your history, what you've been up to, and then we'll crack on and talking about using splints with OA management.
Thank you, Hannah. That's a fabulous introduction for the end of the week. Okay, well, nice to be with you all. My name's Mel. I'm a bit of a strange creature. I'm part human occupational therapist, part veterinary physiotherapist. And splints is an area that's a passion of mine, both in terms of my human practice and my veterinary practice. And I've been lucky enough to combine the two, really. I think it's an area that's kind of emerging a bit in veterinary practice. People are becoming more aware that splints may have a place to a role in management of certain conditions. I'm also passionate that they're used well and that they're used as part of therapy. I worked, just to give you a little bit of background, I did work on a hand unit here in Derby, human hand unit, which is quite a well-known unit, and I still work with children on that unit. So that's children who've got congenital deformities or injuries to their hands. And in that arena, the use of splints is very common, and it's a regular part of the management. And really, I've transferred my knowledge of splint making and the manufacturing techniques and the different plastics and materials that we use into the veterinary arena. And it's an exciting area that I'm still learning a lot about, but very much enjoy working with clients and vets and other physios to perfect.
Definitely. And I guess from a first opinion practitioner standpoint, we don't get taught anything about this. And it's something that's very much within the physiotherapy and the rehab world that a lot of first opinion vets wouldn't have the training. So this is really quite exciting. Now I'm just going to butt in and just do a little bit of a shout out for the new free of charge course we've got going. So this is a free of charge course that was written by the amazing Gemma Hodson, who is a behaviorist as well as an individual that really looks at gait, movement, posture, and teaches a wonderful course about it. So she has brought together an awesome modular little course for owners that are concerned that their dogs may be in pain, and how they can actually look at their dog, extrapolate necessary like objective data, and have conversations with their vets to get the best for that dog. So it's free of charge, and we'll put a link into the feed so you can just go and hop on and have a look through. Share it. It's there to help people. Cool. Right, let's put you away.
Hannah, you didn't tell me there was a basset hound on the opening slide.
I know. This lady's got basset hound shoes.
Basset hound everything.
You are a massive basset lover, aren't you?
I'm afraid.
Cool. Okay, so let's start talking about what are the principles behind using splints. Why would we use a splint? And then we're going to jump into what's the fears of using splints. That leads us into talking about joint, like the biomechanics, so that people have a greater understanding of joints. And then we're going to flick back into OA and keep it on track and do some cases. And then at the end, we're going to look at some timelines. So let's first of all talk about, why do people use splints? What do they bring to the party?
First of all, I think when you say the word splint, most people think of two bits of wood and a bit of cloth and sort of bunging it round a broken bone. Put at its very simplest, a splint is effectively a way of immobilizing a joint, or more than one joint. Usually it's one joint, but sometimes you can immobilize two or more joints in a sequence. When we talk about splints, we usually mean either some sort of fabric like neoprene, Neoprene, for people who don't know, is the similar sort of material as you would find in like a wetsuit, something like that. So it's got stretch to it. Or the other materials that we use are thermoplastics. So these are low temperature plastics that get heated either in hot air, in an oven, or in water, and they become moldable. So the splints that, again, roughly fall into 3 types. There's what I'd call soft splints, which are things made out of neoprene. There's semi-rigid splints, which are often things like a neoprene inner, and you can add extra reinforcement, usually by way of a thin plastic, to give extra stability around a particular area. Or there are rigid splints, which are largely made out of plastic. There are sort of additions as well, in that you can have splints that you can put a hinge in, so you can get a joint moving in one plane. You can also reduce that movement, so you can maybe only allow 20 degrees of movement. So they can become, they range from really relatively simple to really quite complex.
Really? Yeah, and using the term splint almost doesn't do justice for the range. And some are really high tech, and others are literally just a piece of neoprene with some Velcro. So exactly. It's a huge array, isn't it?
It is. But basically, you're just effectively immobilizing that joint for a reason.
And it's different degrees of immobilization as well. It's a spectrum of immobilization, rather than everything being hard and fast, solid, don't move.
Exactly.
Yeah. Okay. So what is the splint trying to achieve apart from the immobilization? So we've got stability, we've got maybe some control of pain and proprioception. So explain these for the followers.
Okay. I'm involved with splints for dogs and other animals with arthritis, but also for other reasons. And sometimes they sort of mix, there's a bit of overlap as well. So one of the main reasons why you might want to splint a joint is if you've got loss of stability. So for people who don't know a lot about the anatomy of the joint, normally a joint is where 2 bones meet, and you need a mechanism for holding those bones together, which is largely the ligaments. So they join bone to bone. And then you've got muscles and tendons that cross over the joint, fascia, and other supporting structures. Now, with degeneration or injury, some of those supporting structures can become damaged, which will cause the joint to move out of its normal plane of movement. And then that in turn causes loss of stability, and it can also cause pain. So, for example, a lateral or a medial ligament rupture would cause the joint to open up on that side and to move more than you would want it to. So sometimes you can use a splint to provide that bit of stability. In arthritis, for example, you get erosion of the joint surface and erosion of the cartilage, and 2 bone ends that would normally move and glide nicely over each other become roughened and restricted, and might move in a slightly abnormal manner. And again, that can cause pain and loss of stability. And so sometimes using a splint around that joint can help to restore some of those functions.
Yeah. And then what about the proprioception? Let's go into proprioception a little bit, because we'll be touching on it later with the soft splints more. What is proprioception? You did a wonderful summary for the flooring, but let's do it again.
Proprioception is such an important part of how all of us, including our doggy friends, organize our movement. So it's how we recognize where our limb is in space. So, for example, most of us coming down a flight of stairs don't look at our feet. And if we do, we're probably likely to tipple over. We do it, we know where our foot is in relation to the stair, because we're getting messages back from our muscles, our tendons, our skin, telling us where our foot is in relation to that step. and where our foot is in relation to our other leg. Now, when you've got damaged joints and inflammation, those messages don't get back so easily. And therefore, it makes it more difficult for the dog to organise their movement. They may be more inclined to push a joint beyond where it's comfortable. They may trip or fall. And
they may place their foot abnormally and then go to place weight on it as they move forward, and the leg slips out sideways.
Exactly.
Yeah. And I think I have to just say what Danny said. So Danny Pountain, she always called proprioceptive deficits like receiving a pixelated message. So, you know, when your TV is perfectly HDR, wonderful, and then the feed gets interrupted and you end up getting this pixelated picture and you're not quite clear what you're watching. And that's what can happen. So you end up placing a foot, or, you know, trying to stand still, but you're drifting off. Proprioception is so important. I didn't really know about it bar spinal problems from university. So we got taught proprioception very much in a spinal damage sense.
Right.
And it wasn't until I got obsessed with arthritis, I was like, oh, it's so important.
It is. And I'm sure a lot of people will have had experience of spraining an ankle. And what's the first thing you often do or want to do if you sprain an ankle? It's to put a piece of tubing grip on, put a crepe bandage on. Now, against our huge muscles in our legs and our joints, really, a piece of crepe bandage is not going to affect that joint in any way. But what it does do, and why people like it and why it feels nice, is it gives you proprioceptive input into that joint and stops you hurting it, because you have that increased awareness of where it is.
Yeah.
And really, to some extent, that's what we're doing with soft splints.
Yeah. And I think just to add to that, so when that bandage is on, it's triggering receptors that wouldn't have otherwise been sending information. We're kind of pulling in spare receptors going, come on, we need you to send information to the brain so we can keep this joint and this limb in the right position in space and time. So yes, that's another thing. So we've got stability, a reduction in pain, a proprioceptive input. So these are all very important things. Now, what can be the concerns of using splints? And this is why we're doing a live. And I'll be really honest, Cam Facebook Lives are driven by owner questions. So you guys on Holly's Army, on the main page, you pose your questions. And we are picking up going, right, they need to know about this, they need to know about that. Because as a vet in the UK, we cannot give direct advice to an owner whose dog or cat is not in our care. So it's a legal requirement that we cannot advise you without you being under our direct supervision. So we try to help you guys by hear what you need, and then we create these lives so that you can come in and self-teach and then go back and work with your own vet. And one of the things that we've been seeing on Holly's Army in the last few months is people talking about purchasing supports. And we're like, right. Now, one of the reasons we have got some supports in the shop is because we want to be able to guide people. We don't want people to just kind of randomly purchase. We want to be able to influence. If you are going to look at supports, we could step in there and go, have you thought about this? But there is a tendency for people to buy stuff online, maybe without the knowledge that's required. So what are the concerns of using splints?
Okay. First of all, I think we need to make clear that splints should be part of therapy. They're not a bung it on and leave it device, okay? And I feel strongly that the splint should be assessed for with you to ensure that it's indicated for your dog, because you can get two dogs with arthritis in the same joint, and one may benefit from a splint, one may not. One of the big problems with splinting a joint is that you are immobilizing a part of the body that is designed to move, and it plays a part in the mobility of that dog. Now, if you take up and do the supporting of that joint, you risk effectively weakening the structures around that joint that ideally we want to be doing the work. So if you immobilize, say, your hock joint, you may be weakening muscles like the gastrocnemius muscle that you are wanting to support that joint. So you have to have a cost benefit conversation in your head about what you think is what you're hoping to get from the splint and whether it's worth the risk. You also have to be monitoring the response to the splint very carefully. So that's one problem.
And you also mentioned before we went live that movement, if something is restricted in movement and we restrict it further, another part of the body is going to have to pick up the slack. And if you've got a dog that had, to you, an obvious abnormal joint, but you haven't got the training to see that actually the joints above and below also have limitations, and by immobilizing that joint, you're going to ask more of them and push them beyond what their happiness is. So you're absolutely right. I think I definitely know my limitations at this. I'd phone you. Mel, help.
And I don't always have easy answers. I want to make out as well, because sometimes you don't know, and sometimes you have to try it, but you have to try it with your eyes open, knowing that there's potentially some problems. And sometimes I can look at a dog and think, I think this is going to help, and actually it doesn't. And sometimes I've looked at dogs and thought, I'm not really sure this is going to be worth trying, but we'll give it a go, and actually it has made a difference. So it isn't a
And that's the problem with buying them online, is that I think people, like with many things, they believe everything comes with a promise, and they'll pop it on and they won't be able to understand the timeline, which we're going to come to later, to see improvement, and they'll just whack it on and it will stay on, and then we're doing all manner of damage. What other things are we really concerned about with using any form of splint?
We're really concerned with pressure sores and sores to the limb of the dog. Now, dogs have far less sort of padding on their distal limbs. Dogs' limbs are made to be lightweight and not carry additional weight because of their part in locomotion. If you put a splint on me, I've got quite a lot of flab to actually of padding. We won't go there, but anyway, that's the reality. Most of our dogs, you look at their limbs and they're very fine. They're very slim. They've got the sort of structures are actually quite close to the surface of the skin.
There's just a thin layer of skin over some of it, isn't there?
And their dog can't tell you that this is rubbing, this is really sore. So the first you're going to notice is a sore or a mark on the dog. Now, I lose sleep worrying that my patients aren't going to get a pressure sore. I have to say, I'm sure you've seen this as well, Hannah, but I've seen, I saw a puppy lose its leg from a badly applied vet.
Oh yeah. I think people really underestimate pressure sores. The body's ability to repair a pressure sore is way longer than it takes to form one. It's pretty dramatic, isn't it? And I think, as you say, I love dogs. This is why I do it. I love dogs, and they're amazing at coping, and it's incredible what they'll put up with before they flag it up. Like if I think about wearing a shoe that's starting to rub. So I've just been wearing some trainers, and I'm starting to limp, and you can hardly see a flesh wound. It's tiny little pinky, and you're going, Hannah, you really are pathetic. Whereas a dog will still carry on walking, and you're like, you've actually got eaten away to the flesh. We're down to bone, and you're still going. It terrifies me. So I'm 100% with you for the fear that people would make homemade splints or purchase a splint and it wasn't appropriate fit for the appropriate joint for the appropriate reason. So I guess we're really doing a big kind of take-home message. Get professional advice. Yeah.
There are some simple rules people can follow as well when you're looking at it. Does this splint fit? So roughly speaking, you need the length of the splint above and below the joint that you're splinting. So say you're making a hock splint, you want 2/3 of the length of the bone above it and 2/3 of the length of the bone below it to be the splint. You don't want it the full length because it's going to impinge on other joints. But if you have too short a lever arm, you're more likely to get sores on your joint. This is one of the problems with off-the-shelf splints, is that because they're made in sort of slightly generic sizes, you know, and you've got everything from a basset hound to a greyhound to an Irish wolfhound to, you know, all sorts of shapes and sizes of dogs, it's very difficult to get a splint that is going to fit this whole variety of breeds.
Yeah, definitely.
So those are important things. You want to make sure if you do a splint up that you do it up firmly, because if it's loose, some people think, oh, I'll be a bit careful with it, I won't do it up so tightly. But if it's too loose, then you get chafing and rubbing of the splint.
And it might even twist and not offer any support in that plane of support.
Exactly.
And I've seen people that make the homemade ones. I've through my career, I've had people come in with gaffer tape and vet wrap around their dog's legs, and you're like, crikey, no. Yeah. Okay. So we've worried about it being too supportive and us having disuse atrophy. We're a bit worried about people that are leaving them on inappropriately long periods of time, not giving them a break. We're worried about sores. We're worried about them not actually even offering support in the plane of movement that we're trying to protect the joint from. So there's a lot of reasons to be quite cautious about using them. Okay, so we've done that. Now let's talk a bit about joint biomechanics, because I think I certainly was at fault at believing that joints have set range of motions. You know, oh yeah, the elbow just does that. That's what it does. And then when you actually think about it, no, it's got a bit of rotation there. It's got a bit of translation. So there's much more movement in these joints than we give them credit. Explain that to us.
Okay. So I think we tend to think of a joint as a simple hinge joint. But actually, that's not really the case. Most joints move in a couple of different planes. The stifle joint in the dog, so the knee joint effectively in the dog. A lot of people will have heard of cruciate ligament ruptures. Now, the cruciate ligament is a ligament that stops the tibia and the femur moving horizontally. And in a dog, the joint is angled as well, unlike in a human where you tend to get a flat joint. And in a dog, you get a degenerative process which leads to rupture of the cruciate ligament. And a lot of people think it's quite easy to, or would be quite easy to put a brace on that joint. Now, I don't make stifle braces. There are quite a few companies that do make stifle braces. They tend to be high temperature thermoplastics. And just to explain the difference, those are usually made over a plaster mold. So most of these dogs will have a plaster cast made of their leg. Plaster will be poured into the cast and make a representation, a plaster representation of the dog's leg. And then the manufacturers will use a high temperature thermoplastic against the plaster to fashion a hinged splint to help to control that movement. Now, I have to be honest, I haven't got huge experience with those splints. I know they can be used for conservative management of cranial cruciate ligaments, but I think there are some concerns with splinting the stifle joint because there is quite a lot of torque as the joint moves through a range of motion. So if you put just a simple hinge on the side of that joint, but actually that joint sort of effectively screws home, you're potentially limiting that movement and also potentially causing joint damage to that. So anything like that has to be used with a lot of caution. And certainly most of Holly's army and most of our CAM followers are, I guess, going to be looking at the simpler end of the splint market, but they may have heard of these sorts of splints. So I think it's
I think the cruciate is always something that people are interested in, because the dog might not be suitable for surgery, the owner might not be in the financial position for surgery, and the owner still wants to do something really supportive, and for the health of their dog, I'll try something else. So they can definitely find themselves online looking at these products. But I definitely later in my vet career started learning that the stifle just wasn't a hinge joint, and there's translation and internal rotation and stuff, and I was like, oh wow, never knew that. So I think we have to be really respectful that joints are a lot more complex in their movement patterns than people think, and splints, if used inappropriately, could really limit a good recovery, because they're not allowing the full range of motion, normal motion, that a joint should have. Okay, so we dealt with biomechanics. Now let's do some cases so people can start kind of seeing where this all fits in. Let's talk about your new fee, because this was quite a dramatic case, really, isn't it? Tell them about the case you've got at the moment.
Okay, I've got an elderly Newfie cross. She's the most gorgeous dog. She's like a mini Newfie, if you like. So she's like a scaled down version of a black Newfoundland. And she presented, a good 6 years ago, with 2 really hot, swollen hock joints, really warm, really enlarged. And she had fairly limited movement at the time. So fast forward to now, and she's got effectively 2 very, very limited hock joints. So there's about 10-15 degrees of movement in her hocks there.
And how many degrees would you expect there to be, so people can really get a grip of this?
Well over 90 degrees of movement in a hock. Now you've slightly put me on the spot, Hannah. I can't remember how many degrees of movement there are in
a lot more.
Yes, a lot more.
A lot more. So what Mel's saying is this dog, it's almost like it's been arthritised. The bony formation of the arthritis has limited any movement. So instead of a lovely movement, we've got this. Yeah. Okay.
So she's got those 2 joints. Those 2 hock joints are also there's a lot of bony overgrowth. Sometimes in arthritis, you will see where the osteophytes have formed lumps and knobbles at the edge of the joint. You can actually see those. And in this particular dog, her hock joints are enormous. They're well beyond a normal contour of a joint. Now, she's actually, in recent years, developed similar problems at her elbows. She's quite interesting because she's got very extreme arthritis in elbows and hocks, but relatively good movement in her other joints. Having said that, she did also have a cranial cruciate rupture, which she's had surgery on. So she has had a really tough time. Hannah and I were talking earlier about her, really, because she's a dog with quite limited movement. She can be quite painful, but she would be a dog who I would be very reluctant to put any sort of splint on. So, for example, should she start to get any hyperextension at her carpal joints, I would be very foolish to try and splint those, really, because if you think about it, if you immobilized her carpal joints and she's got pretty immobile elbow joints already, that movement is largely going to be happening from her shoulder in her thoracic limbs.
And her shoulder might not be up to it.
Her shoulders aren't great anyway. She tends to tweak her shoulders. I see this dog every other week because she's on quite regular maintenance therapy, because she doesn't know she's arthritic like a lot of our dogs, and she wants to have a good time, and she will still chase the cat and chase the squirrel, and and then unfortunately she's very sore afterwards. But she
would be a classic case where somebody might start to see, when we're talking about hyperextended carpe. So the joint down from the elbow, which should be more of an upright stacking joint, you can start to see them bending so that the paw seems flatter on the ground. And that's you can see that a lot. And there would be a real thought, oh, well, I could just help that out. I'll just put a bit of stability there. And as you say, that could actually end up having a knock-on effect in a higher joint. Okay.
This dog is, we're aware that that's a possibility for her, but we're managing her with hydrotherapy, with therapeutic exercise, with medication. So she we're using all the other things in our toolkit to try and manage this particular dog. So again, it's like picking things out of this toolkit that we've got with OA and finding what is most suitable for your particular dog. Mm-hmm. That may be a splint, but it may not.
So with hers, would you ever think about, if you did splint it, just starting as soft as you like and building upwards rather than the reverse, where some people might go, well, let's go in there hard or go home, let's make it really stiff and let's see how she copes. Whereas are you more of a titrate the support up and look at the response?
And by and large, unless you've got a big structural abnormality that you are wanting to compensate for, and that will largely be something that your vet would guide you on, I think my advice to any owner would be to start with a soft neoprene type splint with minimal support and see how your dog responds to that.
Yeah. And then some of them now are doing layers of Velcro, aren't they? So very thick Velcro. Yeah. So you can build up support very subtly rather than even going in with the thermoplastic supports.
Yeah.
Which is quite good. Okay.
Mm-hmm. Different people will have different tools at their disposal as well. I mean, I feel quite strongly that working with a veterinary physio is a good thing to do. We'll all do it perhaps slightly differently. I know Dimesum is really experienced and has got loads of experience making splints for dogs. She and I might do things slightly differently because we've got different materials at our disposal, but it's the same sort of principle.
Yeah. Okay, so then let's talk about another slightly yucky case, a sore case. You were telling me about a puppy, weren't you, that had a splint and it actually got to the point.
Yeah. This was a puppy come over as a rescue dog. And he'd obviously been in a road traffic accident. It was difficult to suss out what other damage he'd got because of the investigations involved in this case. But he was a forelimb amputee, and he had a very collapsed carpal joint. So whereas, like Hannah said, normally your carpal joint, you're stucking, sorry, trying to get this in front of the camera, you're stucking in your wrist quite straight. This dog was flat on his wrist.
Yeah.
And that was a case of me thinking, oh, great, I think if we straighten this up, we might be able to give this dog a much better gait pattern. And unfortunately, because of the compensatory strategies that dog used, that just didn't work at all. It was a disaster. So this is kind of, well, it wasn't a disaster, but it didn't work. And I was hoping it would work, and so were the owners. And I think, again, that's a case of you can think something might work, but it's not until you try it that you're working with that dog's own particular biology, if you like, that you notice whether, you can see whether it's actually going to be useful to you or not.
And explain to me about the compensation. And like we did a little bit of a classic chat where you're so focused on the forelimb that you might not have seen, or it might not have been obvious that the dog's hind limbs were an issue. And through putting that splint on, the dog going, oh, that feels horrendous. Yeah. They toss their weight back and end up creating other problems, don't they? Or exacerbating, bringing forth.
And I think particularly if you get amputee dogs and that as well, because the function of the limbs changes. So normally most dog, and this happens with arthritis as well, so normally the normal use of the pelvic or hind limb is for propulsion, and the normal use of the thoracic limbs is for braking and turning. Whereas actually quite often you'll find an arthritic dog or a dog with hip dysplasia will start to pull with their front legs, and start to propel, to you can see them coming from sit to stand. Instead of getting a nice clean sit up from their hind limbs, they'll pull with their front limbs. And so our dogs compensate for whatever kind of gets thrown at them. But if you then add a splint into that compensated movement pattern, then that can blow their ability to do what they would actually functionally managing.
Yeah, absolutely. So that really tells you that these reassessments are essential. And no offense to any owners, I've only started learning what I know in the last 10 years, and you've been on numerous courses, huge amounts of experience. Owners aren't expected to pick up on these posture change, gait changes, and if they can't pick up on them, they're probably not going to be able to observe them and monitor them. So that's where having a professional holding your hand and doing regular check-ins is really, really important, isn't it?
It is. And I think, I see it as a team with any clients, owners I'm working with, because they bring part of the story and I bring part of the story. Theirs is by far the most important bit, obviously, but sometimes a trained eye looking at a dog's movement pattern dispassionately can actually pick up where that movement pattern is perhaps you've got evidence of weakness, or you've got evidence of instability or poor proprioception, and actually that can then you can bring your two heads together to actually make a decision. I never promise an owner that splint's going to solve this dog's problem. We'll discuss between us the pros and cons, and we'll make a decision to try it or not.
So tell people about, from an owner perspective, let's use a classic carpal hyperextension. And is an owner expected to put this splint on it for it to stay on 6 to 8 weeks, and its jobs are done in like a cast because of a broken bone? How do these splints get used?
Okay. Again, it depends a little bit on the age and the function of the dog. So what I will often find out is things like, how is this dog still going out for walks? Are they pottering around the garden? Is this a very active dog? And it actually, everything comes into it. So what are your floors like? We're back to the subject of floors at home. What have you got in place at home to stop this dog slipping or tripping or falling? That's going to mean the dog's actually safer in the home without a splint on. So usually what I suggest people do is when they get a splint, that they put it on the dog for short periods in the house in a controlled environment, and that they monitor very closely how the dog responds to it. Most dogs, a bit like when you bandage in a cannula in a dog, they think, I've got a broken leg, and they'll hold their leg up for a bit, but fairly soon they get used to it and they adapt to it. So you want to see them walking around the house and using the splint, and then you want to be regularly taking that splint off and looking all the way around the paw and the leg for any signs of marking or sores or rubbing, so that you can be as sure as possible that that splint isn't going to cause the dog a problem. And then I would suggest, if this is a dog that's going out on walks, that people start off with a 5-10 minute walk and wear the splint for that time. So really, you're going to want to wear the splint at the time when the joint is under the greatest stress. And usually that is when exercising outside. So,
well, why do you not have it on the whole time? Because a lot of people would think it's like a bone healing, and that would need to be in a cast. What's the importance of having it being able to be taken on and off?
That goes back to the complications of splint wear, which is you don't want to be doing all the work for the muscles around that joint. So you want to be taking it off and letting those muscles do some of the work that they're supposed to be doing. You also want to be getting the air to the dog's skin so that they're not getting manky inside the splint, and you're not noticing it. Yeah, so again, there are a few instances when splints have to be worn all the time, but that would be usually directed by your vet. That wouldn't be the sort of splints we're talking about.
And that picture changes as everything. You know, we're trying to get tissue healing, and as tissues heal, the need for the splint will change, either greater or less. Yes. So again, working with a professional that can go, we need a bit more or we need a bit less, and we're working our way out. So this leads really nicely into timelines and bringing it back to OA, because sometimes splints can lead to a curative state, and they can be used for, as you say, an acute injury, and you're looking to use the splint for a full recovery. And other times splints are there as a background support system long term, potentially lifelong.
That's
so
right.
Explain that for people, because they'll be like, oh, I didn't realize, I just thought I'd put it on, it'd fix itself, and then we'd take it off and we'd forget about it, put it on a shelf and never use it again.
Okay, right. So dogs with arthritis, like any other dog, can be prone to an injury or a flare up or a tweak. We may know that they've done something, they've landed awkwardly, they've jumped out of a car, they've done something like that, and they may have an acute exacerbation in that limb. So they might be very lame, they might have swelling there, it might be warm. You might have gone to your vet and they've maybe adjusted the medication and suggested you rest that dog. In that case, you could conceivably use a splint for a couple of days, maybe just taking it off when the dog's asleep, to support that joint in an acute flare. But you wouldn't certainly want to do that beyond a week, really, unless you had a very good reason or there was a very a large muscle tear. So general small tweaks, you could wear it for a period of time, and then remember to gradually build up any exercise or activity.
And that's really focusing on the pain control, isn't it? So the acute flare, trying to minimize discomfort, but not influence tissue loss by removing their role.
Exactly. So that would be a short-term thing. Another shorter-term thing may be something like an injury to the Achilles tendon. Again, that would be directed by your vet. So that would be something where I would make a splint to support the hock joint, to take the stress off the Achilles tendon, to let it repair or let it heal. If it was a partial rupture. Now, I've done several of those, and then that is very much directed by your vet, how he or she feels that the tendon is recovering. So that would be an acute instance. Now,
you'll be phasing that out again slowly. Sorry to butt in.
Yeah.
Trying to manage people's expectations. One of the biggest problems in any service industry is managing expectations. So just to fulfill people's expectations, give them greater understanding, tissues, as they heal, they don't go fixed.
Yeah.
They take time to build their strength, and the use of the tissue in a controlled manner will help develop that strength. So many of these splints are phased out slowly so that the strength and the support they provide diminishes bit by bit by bit, and the tissue's going, thank you, oh thank you, oh thank you, I'm ready to go. So so people just understand it's not an on-off situation.
And soft tissue is often more complex than bone when it comes to healing, and a lot of soft tissue has quite a poor blood supply, and so heals very slowly. So all of this needs to be governed by your vet, but it may involve a splint at some part for some of the process.
And it might mean that your splint is adapted, and there might be further costs with that. Yes. I think that's always something It's very difficult because sometimes they can be quite pricey as well. The whole build up, developing it, getting it, ordering it, all the kerfuffle. And then you have to, sorry?
Not an easy option for people. And it takes quite a lot of care and monitoring, and checking that the splint's still fitting properly and is sitting right. And actually it takes quite a lot of owner input, really.
Yeah, definitely. Okay, so now we're going to talk a little bit about timelines. Okay, so people are going to understand tissue healing timelines. What would you be looking at with like an acute injury? So we've talked about a flare being, say, 10-14 days max. But say we've got a damaged ligament. So say we've got a dog that's got OA and they've landed badly because their proprioception's gone and they've actually traumatized a good joint. Okay, so it's a non-arthritic joint and they've ruptured a ligament, not a proper full rupture. What kind of timelines would people?
Well, I'm obviously not an orthopedic surgeon, but largely a full ligament rupture will not generally heal with a splint. So what a splint is there to do is to compensate for the structure of that ligament. So, for example, I had a dog a while ago who had quite a complicated case. He had a Neospora infection, which affected the one limb particularly. He was very weak. And while he was recovering on that limb, because of the additional weight he put on the other limb, he ruptured the lateral collateral ligament of his other hock. So, put in English, basically, most joints have a ligament either side that stops them doing that.
Yeah.
And in this dog's hock joint, the one on the outside of the leg had actually ruptured. Now, nobody wanted to operate on that dog because obviously the dog had been very poorly and was just recovering. So we made a hinged splint because that movement was fine with the dog, but he would have collapsed sideways. So we made a hinged splint on that dog so that he could bend and straighten that joint, but we gave him some stability on the lateral side. And that was until the vet wanted to operate on the joint. Quite a lot of the splints I make are for non-conventional dogs that fall outside your perfect case, if you like. So
I think a definite take home from that is that a splint is not going to allow a ligament that's fully ruptured. It's not the answer. Yeah, there are situations that some dogs cannot have surgery. Surgery isn't available, and you might have to have it as the backup option and hope the scar tissue and the fascial adhesions create some form of strength in that region. But ruptures generally are an orthopedic surgeon's discussion. But what about partial? So say we've got less than 50% rupture. What kind of timelines? I just want people to have expectations of months, not weeks. I want them to kind of really get in their head, this could be 6 months, a year,
Well, exactly. It could be. And I think, it depends largely on how much of the ligament is ruptured and also the function of the dog and the age of the dog and the breed of the dog. All of those things will influence, won't they?
Absolutely.
Any recovery that is made. I think certainly with our older arthritic dogs, we're looking more at comfort and function and keeping them able to do their daily things that they like. They're pottering around, they're sniffing, eating comfortably, resting comfortably, being able to get up, being able to toilet. All of those things are priority. And that's why when you talk about a timeline, I think you're going very much for the softer splints, the lower impact. They're much lighter weight. We don't want to be heavy on our arthritic dog. They're comfortable. because they're soft, they're often warm, and so they give a little bit of local warmth around a joint, they give that proprioceptive input, and they give a little bit of support to the structures. So that thing is ideal.
And I think that's a different, another definite take home is, I know we've talked about sores and we've talked about disuse atrophy and them being used inappropriately, but they should also still be part of that multimodal approach for certain dogs. And, you know, I've got loads to learn about this. I'm quite excited about it, but it's another tool in the toolbox.
It's a tool in the toolbox, and that's what therapy for me is about. As a veterinary physiotherapist, I've got this toolbox which includes hydrotherapy, it includes massage, it includes
good point. Yes, please tell them that it's not just a case of putting a splint on.
No,
go for
it. Okay, so you know, a veterinary physiotherapist has quite an extensive training in your dog's mobility, in joints, in muscles, in tissue healing, as well as all the exercises and hydrotherapy. We can use, you know, electrotherapies. A splint is a part of that toolbox, and really, I would like to see people working with their veterinary physiotherapist to maybe discuss splinting as part of a toolbox of managing their dog.
Definitely.
And like you said, there are times when it might be appropriate for a dog. There are times when it might not. And it also depends what other things you've got at your disposal, really. Is this a dog that can have good quality hydrotherapy as well? Or, you know, because actually hydrotherapy is a hugely proprioceptively enriched environment. If you listen to Barbara Holding's talks that she did for Calm on Hydro, you'll remember that actually hydro is a great place for sort of stimulating a dog's proprioceptive system. So it's not one tool used blanket across the board.
And again, that's one of the fears, is that people will find their way into looking at braces and splints and, you know, all of these orthotic supports, and then go, jobs are done. And you're like, no, definitely weight loss, lifestyle adaptation, you know, looking at other interventions that can have benefit. Well, we got a question. Can I get, you know who it'll be? It's always her. It's this one. It's another physio asking you. So this is Laura. So she's a pediatric physiotherapist. Are splints something all vet physios are taught and are able to do, or is this where you may expect to get referred to someone who has done more specialist training in this area, or does it depend on the complexity or the problem splint?
Very good question, Laura. And it's a bit of all of those. No, not all veterinary physios do get taught about splinting. I've been teaching on 2 courses. I've taught on the Harper course for quite a long time on veterinary splint making. I've also done some teaching for Berkshire College of Agriculture on splinting. But not all physios do. It is really an extended scope skill, largely because there are not that many people who have extensive skills in splinting. So a lot of people don't like to set themselves up saying they can do it. In terms of veterinary physios, I would encourage people to start simple, start with making things like neoprene splints. I'm always happy to be contacted. I've done teaching for vet physio, I've done quite a lot of teaching for vet physios on splint making. So it is something you'll find some vet physios are happy to discuss and talk to you about, and others have got less experience, really. But having said that, most of them should have the skills to look with you. Say you'd purchased an off-the-shelf splint, they should have the skills to say, I think this may help, or I think this won't help, or should we have a look at this dog's response to it. So, for example, most of my clients with osteoarthritis, I know which joints are stiff, I know where they're painful, I know where they tend to carry tightness, and and discomfort. And so I can make a reasonable guess as to whether a splint's going to have a beneficial effect on this dog. And even if your vet physio isn't experienced at making the splints, they may well they will be the best person to discuss whether a splint would be useful for your dog, I think, if that makes sense.
Definitely. Well, we're coming up to an hour, so I'm going to definitely kind of like start wrapping this up. If there are questions, then do ask them. Mel is part of the CAM team. I adore her muchly from the time I met her at the Hydro AGM with your amazing shoes.
Talk about the shoes.
Your Basset Doc Martens, they're just incredible.
Very poor taste, right?
No, they're amazing. But what we will do, we've got a question here. Let's do this one before we do 10 top tips. Does a vet physio do the same as a physio that you go to for the multimodal help, or do they get more complicated? Same as a physio.
There's only one. Veterinary physiotherapy is not a protected title. However, you want to go to a qualified veterinary physiotherapist for your dog's therapy. I'm not entirely sure what the question is totally getting at there.
No, I think it's probably a little bit of the Laura question of are they more specialist trained physios? Yeah. But I think first port of call, guys, is look at RAMP or look at the AHPR. Is that right? I always get the wrong way around.
Health Professions Register, yes, and then you've got your organisations like IRVAP and
NAVP, ACPAT, etc. Yeah. So do go and find somebody that's got the right credentials and have a frank conversation with them. And seriously, hopefully, if you said, I understand that it might not be everybody's forte, how do you feel about splints? I'm quite interested. If you don't know, I'm more than happy to speak to somebody you can recommend. So open the door for them.
And I'm always happy to answer questions. It's not.
I love Mel. She's great. I ask her stuff all the time. You're fab. She was the lady that did the It's My Home tutorial. You. It's amazing. Globally used now. Oh, because of you. Cool. Let's do 10 top tips. So we end on a very helpful section. So anybody that hasn't watched before, 10 top tips are very much focused at your very normal dog owner. And it's about things that you can do that can make a massive impact as of tomorrow. So I'm going to start with number 10. I'm going to steal weight loss. Weight loss. I'm recording lectures for the Chinese Veterinary Society at the moment. I've just done the weight loss module. It is so important. There is more evidence to support the pain relieving benefits of weight loss and the fact that it potentially could slow the progression of the disease. Please, guys, get your dogs slim. Number 9. Get your dog a nice, well-fitting, Y-shaped harness instead of using a lead and collar. Much better for helping the dog to balance and love that.
More fashion.
Do you like perfect fit harnesses?
I do. I also like Makuti balance harnesses.
Cool. We'll see if we can get Makuti in the shop. We've got Perfect Fit about to join the CAM shop. So anybody that's thinking about getting their dog a new harness, please support CAM. You'll find Perfect Fit will be in there by the beginning of next week. And we will speak about Makuti because I'd like to get them in as well. Love it. Number 8, I am going to be controversial. Think about the activities you do with your dogs. We get told that we're a bit anti-ball throwing, but it's not because we're the fun police. It's because you really think about what those dogs' joints are doing when they're braking, turning, torsion, stop, start, landing. If you've got aggravated joints, that's the last thing you want to be doing to them. So I know there's a lot of people out there going, oh God, they're always on about the ball. Think about the logic of it. It makes so much sense. Think about the activities. Number 7.
Okay, number 7. Think about places in your house where your dog twists, turns, stands for any period of time, and make sure you've got non-slip surfaces on them.
Love that. And we've got a major sponsor now. We are supported by Floors for Paws with their new product called Paw Safe, which I have taken upon myself to test because I just so want to make sure that we're only recommending the best, and it is fantastic. Number six, car travel. Most of us do have our dogs in the cars, be it to go to the park, be it to go to hydrotherapy, to the vets, on holiday. And there's a real tendency to plonk them in the boot of the car and not really think much about it. Think about bedding. Think about something that they can lean into. If any of you have ever sat in a boot of a car, maybe on the way back from the pub after a big night, you'll realise it's really quite uncomfortable when you're not in the driving seat. So make sure they've got ability to stabilise themselves and keep themselves comfortable. You do not want to make their condition worse. And make them fearful of the car because they'll start associating the car with pain. We don't want that. Number five,
embrace your dog's sniffer. Basically, sniffing is such a valuable part of being a dog. Don't feel you have to drag your dog on a walk. A 15-minute sniff that's only 2 minutes from your house will be just as much fun for your dog as being marched on a walk. Let them sniff.
Let them sniff. It's almost like let them eat cake. Let them sniff. Number four, please look at what your vet nurses can do for you. Vet nurses that I've worked with through my 20-year career are phenomenal. And they are a hugely underpaid, underutilized pool of talent. So when you go to your practice next, say to receptionists, do you do any nurse clinics? Do you do an arthritis clinic? Are there any nurse-led support services at this practice? Because nurses are known to be able to listen better than vets. They're more likely to identify pain than vets. And they're just freaking fantastic. So make use of your nurses. Number three,
think about the signs of pain in your dog and listen to some of the CAM lives on identifying pain. It's very easy, and I hear so many people say, oh, I don't think they're in pain. But actually, when you look at their behaviour, it would indicate otherwise. And sometimes when you discuss with your vet, starting them on some sort of medication to manage their pain, owners realise they've got a different dog.
Definitely. And that's where this amazing course, which is free of charge, so you will be able to access this. It's at this address, cameducationteachable.com. This is a free of charge course. It will take you no more than an hour, and it gives you an overview of behavior change, posture change, gait change, physical changes. It teaches you how to speak to your vet so that you can get the best results for your dog. Please don't shy away from it. It is there available for you guys. Thank you, Gemma Hodson. Number two, this is a sneaky one from me. There's a lot of hurt in the vet industry at the moment. There's a lot of people that are very tired. They're working very, very hard. We've had a huge rise in pet ownership throughout this pandemic. And the workload being placed upon first opinion vets is phenomenal. I'm on many forums and I have many friends that are vets, and they're struggling. So when you are disenchanted, when you've had an experience that you thought maybe that could be better, just stop and maybe speak to the practice first, rather than jumping online and blaring out to everybody that you've had a bad experience. I just really do see that there's miscommunication going on here. And because your vet, your nurse, your practice is so important in your treatment plan, don't kind of throw the baby out with the bathwater. Go back to the practice, just try and rebuild rather than jumping online and suggesting the world's worst. So it's all about communication and making sure you have a good relationship with your vet practice. A lot of stress in the industry at the moment. Number one.
I have to say, Hannah, I've just got to butt in there. I agree. My vets, the vets I work with and the vets who look after my animals, unbelievable, fantastic people, so dedicated and so highly trained, and really have put up with an awful lot this year. And yeah, I just want to shout out to my vets here. Fantastic people they are. Number one, I think I was very taken by the cam live you had on sleep the other day, and
I know.
I thought that was brilliant. And I think I'd like to say, make sure your dog can stretch out to sleep comfortably. Now, that might involve medication, it might involve their bedding, it might involve looking at where they sleep, but have a look at your dog. Can they sleep comfortably?
Yeah, she's phenomenal, isn't she? Dr. Amber Batson.
Really good.
I know. She's just sent me a long list of references to read about the biome, the gut microbiome. Like, there's 30 papers. I'm like, yay!
You're busy, Hannah.
Anyway, look, Mel, it's always a pleasure. I absolutely adore you. So this is awesome. We'll get you back probably towards the end of the year, maybe beginning of next year, to talk about other skills that you have. Until that point, thank you so much for joining us, and thank you guys for listening. Please spread the word. Canine Arthritis Management is a vet-led resource. It's completely independent. It is totally there to support you, because we want dogs with arthritis to stop being a leading cause of elective euthanasia. Collectively, we can do this. You guys can do it by spreading the word, telling your friends, your family, your colleagues about the signs of pain in dogs so they can get attention sooner and we can get good management plans in place. Brilliant, guys. Until next week, I've got a big name next week. I'm terrified. Deborah Taraka is coming. I'm going to have my wits about me. We're going to be talking about degenerative myelopathy, because that can be a concern as a comorbidity or sometimes a differential diagnosis confusion. So we're going to be talking about degenerative myelopathy next week. Thank you very much, guys. Till then, bye.